FRAXEL is a fractionated laser treatment. It's a non-ablative laser and it actually works against sun damage. It improves sun damaged skin and it will remove the uneven skin tone, and it actually refines and reduces small lines and wrinkles. When we do a FRAXEL, we would first prep the patient. So we would like our patients to use skin care for 2 weeks or even longer, 2 months before we do the FRAXEL. That prepares the skin so that when we do the treatment there's less downtime and we get a better result. The lady that we're going to do this afternoon has got some pain block on her skin, which is a topical anesthetic cream that will just help to make the treatment more tolerable. We usually put that onto the skin about 30 minutes, 45 minutes before we do the treatment, and it just helps to make it more tolerable. So FRAXEL laser can also be used to treat acne scarring, any other scarring on the body, even self-harm scars. When we're treating scars, we need more treatments. You must probably need 4 to 5 treatments to get an improvement on the scar. We can also use it to treat, as I said, fine lines and wrinkles. For that, using maybe 1 or 2 treatments is what we would recommend. Or I prefer to do a combination treatment where we treat the pigmentation and the lines and wrinkles. And we usually will try and use as much energy as your skin can tolerate to give you a good result with one treatment. The other wavelength of the FRAXEL laser will treat pigmented changes on the skin. So the sun damage that causes the uneven skin tone and hyperpigmentation, it can treat that as well. So this is the laser. The laser has integrated in with it a Zimmer cooler system that blows cold air that will give a bit more anesthetic to the skin, and we are ready to start. So today we're going to use a combination treatment. We're going to do the 1550 nanometer and the 1927 nanometer wavelength treatments. So that will give our patient that we're going to do today the best of both worlds. So she's going to get an improvement in the uneven skin tone, and her lines and wrinkles will improve as well. FRAXEL laser is actually a very safe laser. The laser can only fire if the handpiece is in contact with the skin. It's got little rollers that will roll over the skin, and as they move, it actually then is identified by the laser head, which will then fire the little beams of light which will burn little holes into the skin. The way that FRAXEL laser work is that the light will burn into the skin without actually making a hole on the dry surface layer of the skin. So the stratum corneum hasn't got a lot of moisture, and that stays intact. The light will penetrate, it goes into the skin, burns little holes into the skin, which it destroys some of the tissue, leaving the top layer intact, so there's no smoke or plume of smoke coming off the skin. When the light burns into the skin, it causes a heat damage around the holes that it creates in the skin. The area where tissue that's being treated with the heat will release a protein which is called heat shock protein, and that stimulates the formation of collagen. That gives us the rebuild of our skin. That's what's doing the rejuvenating process for us. That process will carry on for up to 6 months after the treatment. So in our clinic we prefer not to do packages of FRAXEL treatment. We prefer to do one decent treatment, because we know you will have an improvement of your skin up to 6 months after we've done the treatment. FRAXEL is my favorite treatment for rejuvenation of the skin, and can be combined with other treatments like dermal fillers, muscle relaxant injections as well. Obviously good skin care is important for you before and after the treatment as well. Typically what we can expect is for the skin to be a little bit puffy for the next 3 days after treatment. the pigmentation will go a little bit darker. After 3 days, you will get a bit of flaking of the skin. With our post-care treatment that we use, we do not see dry, flaky bits of skin because we like to keep the skin a little bit more moist with the occlusive dressing that or ointment that we put on after we do the treatment. Typically, about 5 to 6 days after the treatment, most of that dead layer of skin cells that will be sloughing off or come off, and you'll have a nice pink-looking skin, which will take about 2 weeks to go back to normal-looking skin.